Welcome back to Dr. Sellers Educate. We're happy that you're back to support you on your continued journey. If you haven't already, go ahead and subscribe to this channel so you'll be notified as soon as an episode is released, which usually happens every single week. If you want to go ahead and pull out your resources, you're going to be using Billings and Halstead. Chapter 27 is our focus for our topic related to the importance of clinical teaching competency. And we are answering this question: what is the #1 student satisfier when it comes to the clinical setting, okay, and the clinical faculty role? I think you might be surprised, so make sure you stay tuned. And then the second resource you want to go ahead and pull out is going to be your study worksheet, okay? You can find that right here in the description. Every single time you tune into our episode, we want you printing out that study worksheet. And you might wonder why. Well, research tells us that we are 60%, at least 60, some data says 68%. So at least 60% more likely to retain the information by writing it down. Okay, so make sure you do that every single time. Now, what I want you to put on that study worksheet really are 3 things. Okay, #1, I want you to put the date. You may wonder why that is. And it is because I don't know about you, but for me, I attend a lot of different workshops. And so I want you to remember when you review this content. So when you refer back to it, it will be a guide to help you see how far you have come since you listened to this episode. All right. And then the second focus I want you to have on that study worksheet is writing down your objectives. So what is it that you want us to help you accomplish in this episode? Okay. And then the third component on that study worksheet is going to be your takeaways. Okay, hopefully we're going to clarify a muddy point, or we may trigger some muddy points for you, and that's okay too. Just make sure you email us if you have any questions, info@drsellerseducate.com. Also, as a reminder, I know you've already subscribed to this channel, so thank you for doing that. We also want you to check out our website, and that is drsellerseducate.com. You're going to find a wealth of information and resources to help ensure that you stay on track towards achieving certification or towards closing a loop that you may have related to your knowledge. Or it could be that you just want to make sure that you are staying current on your content review as you recertify with NLN. Okay, so whatever your path looks like, do know that we are here to support you until you are successful. All right, so you have your study worksheet, you have Billings and Halstead. Now I'm going to refer to another resource that you may not have in front of you. And if you don't, we don't want you to go purchase it. However, if you're a clinical faculty member, I would encourage you to purchase it. It is a Springer publication. So if you have a relationship with the Springer rep, you may reach out to them. Okay, but it is Clinical Teaching Strategies, and it is written by Oermann, Shellenbarger, and Gaberson. Okay, so it was published in 2023, so 6th edition. Again, is Clinical Teaching Strategies in Nursing. Okay, we are going to refer to this textbook, Chapter 27 in Billings and Halstead, is your primary text for this episode, but a secondary text is going to be this great publication. And let me tell you a little bit about what we like about it. First, it's current, okay? And so there are lots of evidence-based strategies that are listed in this textbook. However, Billings and Halstead also has many of these principles and concepts described in its textbook as well. Okay, so don't feel like you're missing out if you don't have the Oermann text. However, if you are interested in just kind of refreshing your skills, then this is an excellent textbook to choose. So let's go ahead and jump into our content now that you have all of your resources available. When we take a look at what the #1 student satisfier in the clinical setting, we first want to talk about our thought-provoking question, right? Of course, let's take a look at it. So clinical competence is a core responsibility of clinical faculty. When onboarding new clinical faculty, which would best support their success? All right, so we have A, provide orientation to the skills sim lab to evaluate their clinical skills. B, include didactic teaching assignments to help them align clinical assignments. C, orientation to the clinical setting to increase competence and familiarity. Or D, describe the goal of using first impressions to make decisions about clinical performance. Okay, so think about what those 4 choices are. And as always, we want you to do 2 things for every question on the CNE clinical or CNE novice exam. First, you want to think about what is the question asking you. Okay, so many of the questions, not all, but many of the questions you will see in a 3-part question format. First will be the stem or the statement. There's some type of fact, oftentimes, that is introduced in the question. Second of all will be the scenario. Okay, so some type of statement or bridging statement related to the introduction statement or the stem. So that's the second part. You're going to be introduced to a scenario. And then the third component could be the question. So again, you want to think about what is the question asking you, number 1. Number 2, what is it that you know for sure about this question? All right, so if nothing seems familiar related to this question, then there is an option to skip right now. That functionality is part of the exam. And so you want to skip it, and then you want to come back to it. All right, so for purposes of this thought-provoking question, I want you to think about what is it that you know for sure about the role of the clinical faculty and the onboarding process. All right, so this is the research that was done by Loverick and others in 2015. The number 1 competency that students felt like helped them be most successful was the ability to teach. Isn't that impressive? Right? And you may wonder, well, how do students know if we are a good teacher or not? Well, I'm sure we can all remember some traits that categorized our clinical faculty as good teachers. So number 1, students reported that the most important competency of clinical nurse educator is teaching ability. Okay, so clinical competency is not enough. That is what that data has shown us. Okay, so let's talk about breaking that down into 3 different categories. What are some of those clinical teaching best practices? Well, number 1 is going to be observing performance. Okay, so we're going to break that down. What does that mean? Number 2 is knowledge and clinical competence. Number 3 is skills and clinical teaching excellence. All right, so let's break those down a little bit. First of all, if you do have the Oermann text, let's start by looking at page, and it's going to be chapter 5, but you're going to start on page 90. Okay, so that's where you're going to see exhibit 5.3, clinical teaching skills. And then you're going to proceed about 5 pages or so. Again, just highlighting, what we're going to do is just highlight some of these clinical teaching strategies that are listed in this great textbook. So observing performance. We want to spend time as clinical faculty getting to know our students. Okay, we know that students can become very nervous when it comes to demonstrating their clinical skills. And so we want to develop an open relationship with our students where they feel comfortable coming to us about any questions that they have in the clinical setting. Another keynote about observing performance, other than number 1, realizing that students have a lot of anxiety, okay, about being in the clinical space. Number 2 is to be clear. A strategy we can use is to be clear with students about, during our pre-conference, about what our expectations are of them during that day as it relates to their performance. As an example, if they have a heart failure patient, and this is a semester 4 student, their last semester, we would expect them to be able to articulate and analyze, as well as demonstrate, some advanced clinical care strategies when it comes to care of the heart failure patient, such as we expect them to know that they should check their lab work, specifically looking at their electrolytes. We expect them to look at the medication list and to know if the patient's on a diuretic, that they should be checking their eyes and nose, that they should be checking their diet. So there are certain care practices when it comes to observing performance that we expect more advanced students to be able to demonstrate, as opposed to our semester 1 fundamental student or med-surg student, med-surg 1, we would not expect them to be able to demonstrate that level of performance. Okay, so that's the second point, is we want to set the expectation with our students during pre-conference. But number 3, we want to consider our students' level of knowledge as we give them formative feedback that in real time, right? We want to give it timely, so that they can make adjustments to their clinical practices to improve their performance. Okay, so those are some of the key best practices when it comes to observing performance, realizing that first impressions with our students, it may not be a reflection of their overall ability to perform these skills because they're very nervous. All right, number 2 is knowledge and clinical competence. This is a big one. It ties back to the number 1 skill set that our students are most satisfied with, and that is with our ability to teach. Well, what goes hand in hand with our ability to teach is us having the knowledge related to that clinical setting. Okay, so with our clinical faculty, we want to make sure that a critical piece of the onboarding is them being introduced in the clinical setting, then becoming more familiar with it, because that's going to decrease our clinical faculty's anxiety as well. We've all been a first-time clinical educator or educator in the classroom. And one of the key steps when it comes to the clinical setting is having an increased awareness of the actual healthcare environment, having a chance to go up and tour the unit, to introduce ourselves to the clinical educator, to the clinical manager, so that they know who we are, talking a little bit about our students, getting to know a little bit more about the type of patients that are cared for on that specific unit. All of these onboarding strategies are going to help our clinical faculty feel more confident and competent in that clinical setting. Okay, so what we want to do is take a second, even if we're in the didactic setting, and stand in the shoes of our clinical faculty and make sure that we're doing every single thing that we can to help them be successful. All right, so that knowledge level starts with the individual. So as clinical faculty, we've got to know where our knowledge gaps are. I gave an example that was specific to cardiac because that's my clinical expertise, right? But when it comes to clinical competence, our ability to teach and the knowledge that we have may not be aligned. So we have to make sure that we're not only clinically competent when it comes to the knowledge of the patient care delivery process and what's needed, but also we've got to be competent in our teaching strategies that we're using as well. And what should that look like? First and foremost is to be engaged with our students to set them up for success. We should know what our students' knowledge gaps are and ensure during our pre-conference that we help them develop a plan for the day. We want to be available to our students. We know with the traditional model, as what's described in Billings and Halstead, as well as in Dr. Oermann's book, that the traditional model can cause more stress for the clinical faculty because there are multiple students that have different types of needs. We want to set our students up for success by, first of all, again, being clear with our expectations of their performance, answering their questions during pre-conference, making sure that when we have the pre-conference that we're fully engaged and prepared for the day as a clinical faculty member. So all of these key teaching strategies are aligned with knowledge, clinical competency, and our ability to teach, which brings us to number 3, our skills in clinical teaching excellence. One of the key strategies when it comes to having strong skills in the clinical setting is increasing our competence. Okay, our competence in understanding the type of patients that are on that specific unit and what technology do we need to become familiar with. A good example is going to be what are the healthcare providers' policies around documentation. You can see the picture here. Are our nursing students allowed to chart? How do they access the information in the chart? Is it view only? Oftentimes that is the case. We want to be clear about what the expectations are and really the access, more even than expectations. But number 1 is access. So what information do we have access to as clinical faculty for our students? And what are the expectations as to how we're going to document medications that are given or assessments that are completed? And then that second component, when we talk about clinical teaching, really is that equipment. A good example is going to be a chest tube. If we want our students, level 4 students as an example, to have a better understanding of care of the patient that has a chest tube, understanding what that healthcare partner's policies are around how to care for chest tubes. We want to make sure that we are properly trained on any type of technology before we arrive in that clinical setting, right? So that is us taking our responsibility as a person that is committed to lifelong learning and closing our knowledge gaps before we show up in the clinical space with our students to ensure that they are delivering safe care. We have to be knowledgeable about that equipment, about technology as well. All right, so again, when it comes to skills, we want to be competent and confident. That requires us to be properly trained and to develop relationships with our healthcare partners so that we understand those policies, procedures, and they in turn understand what our nursing students are capable of doing in the clinical setting. All right, so let's check them all off. I know that was a lot. Number one, what are these clinical best practices that we're talking about? Number one is observant performance, okay? Number two is going to be me taking responsibility for being knowledgeable and being competent about the patient care that is delivered in that clinical setting, right? I want to maintain my level of expertise in my role as a clinical faculty member. And then number three is I want to have advanced skills as a clinical teacher, right? So I want to do my part to make sure that I am engaging in faculty development so that I can close my knowledge gaps to improve my clinical teaching skills with every interaction that I have with my students. All right, and we know it's a process. All right, so if you chose C, orientation to the clinical setting to increase competency and familiarity, you are correct. I tried to give several cues along the way and clues about related to this thought-provoking question. And remember, that's exactly what this is. Okay, so if you didn't choose C, I don't want you to stress out. It's okay. The good news is this question will not show up on the CNE clinical, or CNE novice exams. We don't write questions for NLN, but what we do want to make sure you are doing is thinking about these concepts that we're talking about in this thought-provoking question and determining if there are any muddy points for you. And if you do have muddy points, we want you to, again, go back to your resource bin, primarily Billings and Halstead, chapter 27. That's where you're going to see information about skills needed in order for clinical faculty to achieve the level of competency that NLN expects. All right, so let's talk a little bit about why A, B, and D are not correct. So A, provide orientation to the skills sim lab to evaluate their clinical skills. Well, it may be good to provide an orientation, but we're not necessarily going to evaluate their clinical skills, right? That can be a little bit, I think, demoralizing if that's part of the onboarding process. And also remember that the question was, which is going to best support their success? We would hope as a clinical faculty member that if there's a specific skill that they're not knowledgeable about, that they would raise their hand and say, you know what, do you mind, mentor, helping me solidify a certain skill or giving me access to information about a specific skill, just so I can kind of hone in on it a little bit more to become more confident in my knowledge. All right, and then B, include didactic teaching assignments to help them align clinical assignments. Well, what we want to be careful about is exactly what Oermann talks about in the clinical teaching strategies textbook, is making sure that when we have clinical faculty, that they have a level of expertise that is going to allow them to transfer that clinical knowledge that they have in a way that's going to support student learning. Okay, so that's one component. We want them to have that clinical expertise. And second of all, we want them to be a really good teacher. All right, so teaching didactic courses doesn't necessarily support their success in a clinical faculty role. And then D, describe the goal of using first impressions to make decisions. We talked about the fact that we don't want to use first impressions. Okay, again, it comes directly out of Oermann's book. We want the students to have time to really decrease their anxiety and develop their clinical skills in a way that they are approaching a higher level ability to utilize clinical judgment when making patient care decisions. Okay, so that's why C is the best answer, because again, that orientation piece to the clinical setting is going to help them be more confident as well as competent when it comes to their ability to support the student learning process. So we hope that this information has been helpful for you. We know this was a lot of information. However, do know that our goal is to help you close your knowledge gaps using the primary textbooks that we have listed out as part of our snapshot during our time together. And if you have any questions, reach out to us, info@drsellers.educate.com. We hope to see you at our upcoming webinar. We have several of them coming up, no matter when you're watching this episode. So check out our website and we will see you there. Have a great one, everybody. Bye-bye.